Hello, my name is Elizabeth Cantwell. The topic I chose for this assignment was transgender youth. Let's first start off with the definition of transgender. Being transgender is defined as those individuals who have a gender identity opposite of the sex the individual is born into. Transgender people are born with the anatomy, sex characteristics that differ from what sex they believe they are. For example, a woman may be born with, say, a vagina, but she feels she is a man on the inside and claims the male gender as her identity instead of a female. So, on the slide, as you can see, there's definitions of the selected gender identity terms. So there's different you can look on there, seeing what the difference is of a genderqueer, cisgender. Basically, it just means the social norm of what is currently what people believe to be as normal, as like a male is born with male anatomy, whereas a female as well is born with female anatomy. So there's that for you. Um, then we also are going to look into the size of the transgender population. So locally, I put locally as in within my workplace. So there's two individuals who identify as transgender in the facility I work at, which is a youth treatment facility for behavioral health, and that would make up 0.2% of the facility um, out of all the kids. Statewide in Utah, there are about 1,400 children who identify as transgender. Nationally, there's 0.7% of youth ages 13 to 17 in the United States who identify as transgender. I was not able to find an global statistic, but another fun fact I did find was that transgender individuals, it is more common to be Black, American Indian / Alaska Native, or Hispanic. Um, Next, I will talk about social determinants of health. So, the first one is social support, social norms, and attitudes. So, support is a big area that transgender teens struggle with. So, most teenagers in general feel like they don't have enough support. When a teen is struggling with like an identity crisis, um, finding individuals with similar problems may be more difficult than those who aren't struggling with those kind of things. The social norm is that a female is born with female parts and a male is born with male parts, and that's what distinguishes between female and male. But those who are transgender are born with certain characteristics, sex characteristics, but that doesn't mean they want to or feel like they're that gender. Being transgender goes against the social norm just because just because people don't consider it normal. So that's why it would go against the norm. Um, when people go against the social norm, others may look at the teen negative or in a different way. And definitely that doesn't mean it's right, but they just view it as different. Culture. So those who grew up within a certain culture are taught things in a specific way. If something is different from what they're taught, it can be confusing for them, and discrimination can occur. Um, and so then the access to job opportunities, businesses can discriminate against transgender people, even though it's illegal. It's illegal to discriminate, although it doesn't mean that doesn't happen in society. And the statistic that I found was that transgender people are twice as likely to be unemployed, and 90% report either being harassed or mistreated at work, or they're taking steps to avoid workplace mistreatment, which I found interesting and sad. Um, the and then the social determinant of availability of community-based resources in support of community living. So transgender teens may find it difficult to find community-based resources and support due to them being such a small group. Communities normally have programs that normally help with like a lot of people, but because it's such of a small group, it might be a little bit harder. But there are support groups out there that may be helpful for them. So the next slide talks about contributing factors, which I went over. I like to go over like the physical, the psychosocial, and the economic. So the physical is um, basically they are individuals who don't feel like they're in the right body due to their anatomy. And so hormone therapy and surgery are commonly used by those by transgender individuals. So, and these can be dangerous for them. These hormone imbalances or surgical complications that can go along with that. And so that can be concerning. The so psychosocial, these transgender youth are very heightened risk for negative psychosocial outcomes. So they have a 2 to 3 fold greater risk of depression, anxiety, suicide ideation, self-harm, and inpatient and outpatient mental health care utilization. And the economic concern is the workplace discrimination, the judgmental peers, and they're less likely to be in a higher income bracket. And yeah, so that is crazy. It's just there's different statistics that prove that there's an issue with them in the workplace. So why are these people vulnerable? I've kind of gone over it a little bit, but due to them having depression, anxiety, the suicide risk, self-harm, they're mentally unstable most of the time, economic hardships for them and their families. They do have risks of certain diseases, and they due to physicians aren't really specializing in this as often as, say, family practice or other areas, so they have a harder access to physicians. So Maslow's hierarchy of needs. So the met needs are the physiological. That's the basic. They have food, they have shelter and water. Most of the time, I mean, there wasn't anything really about homelessness, but there are a lot of unmet needs. A lot of them don't feel safe, especially in the workplace. And like emotionally, their self-esteem is really low, and love and belonging, they have a hard time with relationships just because other people in the community, they look at them as different, and they have a hard time with that. And um, they the anticipated function level is really about safety, and so they kind of sit on that safety border between physiological and safety, like they meet the physiological step of Maslow's, but that safety portion is kind of where they're hanging out at. Like, do they get there, do they not get there, is kind of the question. Not saying that some transgender people cannot accomplish all of these steps. That's not what I'm saying. It's just more common that they don't. And the likely health outcomes are mostly negative. Specific communicable diseases or infections, their increased risk of STDs, sexually transmitted diseases, such as HIV, chlamydia, gonorrhea, and extragenital chlamydial and or gonococcal infections. Below in the notes, it does talk about like statistics if you're interested in that. Other non-communicable diseases are diseases that shows the mental health is huge. PTSD, anxiety disorders, major depressive disorders, and schizophrenia. The mental health really affects this population. Some of the conditions that I thought were kind of interesting were the rheumatoid arthritis and the diabetes. I thought those were kind of interesting. But if you look at the bottom here, these conditions occur in 1/4 of the transgender population. That's actually I felt like that was a big part. Like that's 25%, So that's pretty big. Is there risk for harm by them or to others? For sure. They have gender-based abuse and neglect. A study in the United States reported that gender-based abuse, neglect, and bullying are the most common for adolescents who are sexual or gender minorities than others who are not the minority. And they also found that 92% of those involved in that study who were transgender reported parental abuse, neglect, bullying, and other forms of abuse. So these people in the transgender population, they really do struggle with abuse. So self-care and self-harm, transgender individuals, they all have, as the statistic shows, 13 to 45% of them, 16 to 20, report self-harm. So that's a huge statistic. And the risk of suicide, there's multiple statistics when looking into this about suicide, and it's very difficult for these individuals because their mental health is really, really unstable. And they're less likely to have healthcare coverage than those who are now transgender, which definitely affects their self-care. If you don't have coverage, it's really hard to, take care of yourself if you're not able to go to the doctor as often. Some things that we can help these people: online support groups and people being open to a different kind of, it's a medical condition, and so we need to really be understanding and, not judge them, and really welcome them into our lives with open arms and not cast, judgment, and let them know that um, that's not a factor, that affects us. So it was really interesting looking into this, and I hope you guys will enjoy this presentation as much as I enjoyed looking into it. It was really fun. And if you have any questions, just look into the notes a little bit more. I did put a little bit more detail. So any questions, shoot me an email.